So we are going to go ahead and get started. Thank you all for joining today. My name is Laci Cornelison. I'm the interim director of the Center on Aging and the director of the PEAK program. JC was not able to join us today, and so I'm going to be tackling the topic of daily routines and welcoming new residents. So I'm going to share a little bit of content on your screen. So I'll get that started here real quick. And then we'll do this for about 20 to 30 minutes and then open it up for questions. And what I encourage you to think about is the goal of what you want to take out of this session today. And if that's not covered in the content I have, make sure you ask the questions you want to know about. And then also, if you have some best practices around this topic that you do in your home, feel free to share those so that others can benefit from that. Because that's always a really fun part about these sessions, is learning from others, other providers. So we're going to talk through current practices and the PEAK outcomes, and then talk about some best practices that we know about, and then touch on a few reminders, and then we'll open it up for dialogue and questions. So let's talk through daily routines. This is one of the PEAK cores, and the overall goal of this core is to support lifelong daily routines established by individuals before they move into the nursing home. So something I really want to highlight about this goal is that we're not looking for specific pieces of information about the person, like do they want a bath or a shower. We're really looking for what were their patterns lifelong? What did they do at home to keep clean, for instance? And so that's something I really want to highlight as we think through some of the next pieces of information. Or are you asking the right questions, and are you leaving things open so that residents can tell you how what their habits were at home and things that they've done lifelong. So the PEAK criteria for daily routines is listed on your screen there. And so these are the specific things or touch points that are the specific outcomes we want to make sure we're meeting for PEAK, but they aren't a limiting factor. So, you can go above and beyond this. There's a range of different ways that people have implemented these things, but these are the main non-negotiables to meet the criteria for the PEAK program. So the first is related to move-in, that you have a process of gathering information about residents' routines and preferences before they move in. There are
I'm reading all. I'm like, yep, all that seems familiar.
Okay.
Oh,
okay. Muted. We got that. So as far as gathering that information, we all know that there's times when there's an emergency admission, or you just don't have the lead time to gather information prior. That's going to happen from time to time, but we want to make sure that our systems include in our screening tools and all of that questions and assessments that ask about routines and preferences and not just clinical information. Once you gather that information prior, we're looking for systems that or processes that you have to give caregivers access to that information. So it's a communication then. Once you have the information, how are you communicating it to the people that will take care of that individual when they move in so that they can support daily routines from day one? So that's that third outcome, is caregivers are supporting daily routines from day one. They can't do that if they don't have the information. So that's that loop from having the information to closing the gap in implementing. The next section is on person-centered care plan development. And And this is about really care plan attendance. So 90% of care plans are attended by residents and or family, and residents and or family participate in the creation of the care plan. And how this is evaluated by the peak team is kind of good to start with the end in mind and back into it is you would record attendance at care plan meetings, and if your evaluation is in February, you'd look back at the past 3 months at all of the care plans that were attended by a resident and their family, or by a family member. So you're really looking at that the care plan was attended by at least one of those individuals. And you pick your best attendance month during that 3-month time frame. So if you're looking back from February, you would look at November, December, and January. I look at your best attendance in that 3-month window, pick your best month and submit that as your care plan attendance. So the only care plans that would not count in the 90% are those that were not at all attended by a resident or a family member. So if they were attended by a resident or a family member, they would count towards that 90%. Then the next piece is direct caregiver attendance at the care plan meeting. And this is direct attendance at the care plan meeting, not reviewing the care plan ahead of time or giving input on the care plan. It is actual attendance at the meeting. A lot of homes have addressed this in different ways. One is that, maybe the first part of the care plan is really focused on that direct caregiver update and questions for the direct caregiver. It's often, to make that successful, is really identifying what the role of the direct caregiver is there and equipping them with tools to feel comfortable in the care plan meeting. But their actual attendance at the care plan meeting is what we're looking at with the 90%. And it is evaluated in the same way as I described the resident and family attendance. That 3-month window, you pick your best month. And then finally is care plan delivery. All caregivers have access to care plan information, and that there is a system available for direct caregivers to communicate care changes as residents desire. So if they're noticing a change in the resident and want to communicate that to update the care plan, or for residents asking for a change that affects the care plan, that there is a system for them to communicate those changes that is either electronic or written and not solely based on verbal communication. And then the final one is direct daily routines are lived as outlined by the care plan. For this particular outcome, we're really looking at the care plan itself, and whether it has person-centered interventions in it, included in it, that's a piece of it, and then looking for evidence of those routines and preferences being lived out. Often, this is a collection of all of the things coming together, really. Okay, so we've talked about these specifically. Some ideas related to welcoming new residents is what I want to get into now. So when somebody moves in to your home, it's a big transition for them. And a lot happens in that first window of time. But there's some really cool things that homes are doing in peak that can make this, from the residents' perspective, easier for them. So in some homes, they have a meet and greet party with other residents. So maybe during the activity in the afternoon, the day that the resident comes, or the next day after the resident comes, there's a time where the residents introduced to the other people that live there. Another is that we invite current residents to make gifts for the new resident, and then there's a collection of those gifts that that can be they might be kept somewhere, and then you can pull those gifts out and give them to new residents when they come in. Variety of different things that might appeal to different types of residents that move in and what you're getting to know about that person. Just as a personal touch that somebody who lives in that home made something that is welcoming that person in. A welcome card. It's another idea that's done by staff and or residents. That has like a personal greeting in it and might be in the resident's room when they arrive, waiting for them. Resident welcoming committees are another idea that residents on a voluntary basis are a part of a group that is kind of in charge of welcoming new residents, and they decide how they want to welcome the new resident, and they're kind of the face that new residents that come in, somebody from the welcoming committee or even multiple residents from the welcome committee are tasked with helping that resident get introduced to the home, to get introduced to other residents, to feel comfortable on that first day in the dining room, and kind of where to sit. They're somebody that the resident could ask questions of, like, how does this really work? What's this all about, kind of thing, just to help them ease into the transition. Another idea is to create a welcome basket. And in one home, how they've operationalized this is they gather information about the resident before they move in and find out, all different types of preferences. But one of those preferences being like their favorite snack, and their favorite like comfort food meal, maybe, something that they like as a treat, that sort of thing. And then they include that personalized item in the welcome basket. And then within the first week that they're there, the kitchen prepares their comfort food meal that first week when they're there for them. And that's a really individualized approach to that welcome basket. So it's not just filled with generic types of items that would be generally appealing to a wide audience. It includes some very specific things that are individualized to the person. The ambassador program is kind of similar to the welcoming committee, but the ambassador's role is to really like kind of take on some, individual residents, take on a new resident that they are intentionally forming a relationship with over time. And so they help welcome them, but they're also checking in with them periodically over time. And then I talked a little bit about the favorite meal in conjunction with the welcome basket, but some homes do this separately, but really having the resident's favorite meal within that first week when they're there. So those are some general welcoming best practices. I did want to share some great peak resources. If this is a core that you're working on this year, you've probably already written an action plan, but if you didn't know that this exists, I think it's really helpful, a really helpful tool. And it's you can access this from the Peak website, but it's a way to walk through areas that you don't yet have implemented in your home. How can you identify what needs to change and develop action steps for getting that implemented? And it just really walks you through the steps for that. So anytime you're action planning on any of the cores, this is a really great resource. There's one for every core, and it helps get your team involved in deciding how you want to implement that. So that's one resource. when you're thinking about making changes with your team, or even if you think about change in general, if you tell somebody what you're going to do and how they're going to do it, there's a lot less chance that that change actually happens. But if you get a team or people involved in deciding how you're going to do it there, it really increases buy-in, which improves the chances that it'll actually be implemented into the day-to-day. And so if your action plans around daily routines, for instance, somebody wrote it in an office and then you're tasked with making it happen, you might back up a step, and it doesn't mean you have to start all over, but back up a step and lean into some of the things we just talked about today and get a group involved in thinking through, how do we want to do this here? Take some of the best practices you learned today, bring them to the team and say, what do you think of these and what do you think we want to do? And then once you decide as a group what that is, start figuring out your to-do list. What would we actually have to do to make that happen? And get volunteers to take on some of those different items on the to-do list. And that will really increase the buy-in for making this a reality. Another tool, if you're not familiar with it, is the core area audit. So if this is a core that you've passed already, but you're wondering, how are we doing with this? Have we backslid in any areas? Are we still doing the things I think we're doing? This is a great tool for that. And it basically walks through some of the same questions and documents and interviews that the peak evaluation team does when we're on site, but you can do it yourself and identify things that are solidly in place and going well, and things that maybe are not going the same way you thought that they were going. And so, leaders can do this, but also anybody on your team could use this tool and walk through and just check in on this practice to see how you're doing with it. So this audit tool is really to check the current status of your practices for quality improvement and for maintenance of practices. There's also some really great resources out there related to this topic. So one is from the Pioneer Network. It's a welcome sheet for the first 24 hours. And I'm gonna have Jenny, she's sitting right next to me, send out the PowerPoints from today so that you can click on some of these links if you're interested in taking a look at that further. So as we think about the daily routines assessments, like the gathering of preference information and routines, I encourage everybody to take a look at all of the assessment tools that you're currently using, particularly the social service history assessment, your move-in assessments, whatever those might be, and really look at through that lens of what I brought up early in the session, which is, are you learning about lifelong habits, practices, preferences that the resident has? And so looking at those for open-ended questions that really kind of find out their story, what are they doing, that they're collecting a variety of information, and are you reviewing that periodically? So kind of scrutinize some of your tools just to make sure and refresh or adapt things that you have to amplify your practices. It's not always about doing, just meeting the peak outcomes, but really just thinking through your practices for quality improvement. It's what it's all about. One of the tools or resources that we're going to be making available very soon, JC Hughes and Jenny have been working on a sample, like move-in packet or assessment packet that will be posted on the website. And then there's kind of a second version of that that's not as comprehensive, but would be another version of that will also be made available. And then nationally, I've been involved with the Moving Forward Nursing Home Quality Coalition. And they have developed a guidebook for collecting residents' goals, preferences, and priorities, and documenting those. Collecting those, documenting their goals, preferences, and priorities, and then implementing them into care.
Yeah.
And so
No,
that-
Sure.
I got a hole punch there.
that's going to be coming available down the road. But there's some resources related to that. There's a few homes here in Kansas that are going to be participating in the pilot study for that. And so we're going to be learning a lot. So if there's some information we can share from that, we will be doing that over the course of the next year and into next year as well. We are trying to recruit one more home for that pilot study. That's a for-profit home that's larger in size. So if anybody on the call is interested in getting involved in that fits that description, do let me know. We'd be happy to have you involved in the in that project. So just a couple of announcements before we shift to question and answer is that we would love for you to keep us updated if your peak contact person has changed so that we can update contact information. We've went to a different approach with contact information because our email system wasn't doing that very efficiently. And it's going to allow us to keep in contact with you better and involve more people in that contact exchange. But we need to keep those updated and current so that you get the information that's being shared. So stay in touch with us on that. The next Lunch and Learn is July 18th, and it's on the topic of risk. And the Wheatlands Healthcare Center is going to present some of the content on that. And then a reminder that the Person-Centered Care Conference is coming up October 9th. And so get that on your calendar. We'll have registrations opening closer to that time, but it's a great conference to get whole teams involved in. So think beyond just your leaders, get some of your direct care staff, people from any of your different service departments involved in that conference. All right. So I'm going to open it up for questions and stop sharing here. Again, questions that you have and best practices that you have that you do in your home. If you don't feel comfortable unmuting and sharing your question, you can put it in the chat as well. I'll be monitoring that. If you have questions unrelated to this topic that are just related to peak, feel free to share those as well. A quiet group today. Any questions? Is anybody working on this particular core this year? And if so, would you mind telling us what you're doing? Awesome. We have one in the chat that says we have a really comprehensive home interview that really helps with the move-in process. We gather that information, write a bio that all staff can read. This is fantastic. When you say home interview, you're actually going to the resident's home to do that interview. Is that correct? Yes. Yeah. So going to the home. And you know, I'm sure that many of you know even more so than I do, but going to a person's home can tell you a lot in and of itself too, just how they live, different contextual information as well as alongside the information that they're sharing with you, which is tremendous. She says we take several staff and the interview takes about 2 hours. How do you feel about that investment of time? Do you feel like it's wasted time, worth it time? What are your thoughts on that? Do you have pushback about that? I'm putting you on the spot. Other best practices. It's a really good one. I believe we'll probably get a response here, but one thing I want to share from the national group is, so I'm on a group that works with the person-centered care, goal for the project for moving forward, but we are, working collaboratively with the health information technology team and with the quality improvement group. And that relationship's been really strong. We're focused on residents and their goals, preferences, and priorities and elevating that into the care process. But the HIT group has been working directly with residents and a whole database of information collected from the advanced care planning process to figure out what is it that's important to residents. And in resident focus groups and in all that data, some of the top things that residents talk about is that move-in process and people knowing a little something about them, and that, you know, that having some really key things in place before they get there or within that first couple days makes the biggest difference for them. And so I think that really reinforces how important that transition point is for people. So there's a question for Peak. Does this only apply for long-term care residents and exclude people on skilled rehab services? So this applies to all residents. However, we understand that people that going into skilled rehab, that's where the chances that it is a quick move in from wherever they were, whether it's the hospital or another level of care to you, can be much faster. And so that process of gathering that information is still really important, but it may not be this extended 2-hour interview in the home because they might be coming from another care setting and be coming to you very quickly. So what a lot of homes do is they take an abbreviated preference and routine information questionnaire for those situations. And they might do it on the phone with a family member. If that resident cannot participate in it, they might go to the hospital to get that information or the care setting the person's at and get that abbreviated information, and then do some of the extended stuff in the first few days, depending on how long the person stays there. But it still needs to be in the fabric of what you're collecting, not just the key clinical information. So hopefully that answered your question. I would also say that if you have multiple levels of living in your home as well, so maybe you have an assisted living, that it's important internally to do this as well, because the staff that take care of the person or connect with the person in home health or in assisted living, they're different than the people in long-term care. And so the goal of that is that the care staff that will be providing the care get to know that resident and know key crucial information to help support routines in the new living setting. So even different levels of living, this is important there as well. Okay, so again, I had asked about the 2-hour interview in the home and kind of pushback and different things that they might get, or if it's difficult. So the response is, my microphone doesn't work, so I have lots of typing. Very much worth it, she says. Sometimes more than 2 hours. It's really great to take direct care staff so they hear firsthand what the daily routine is. Typically our restorative and our DON from the nursing aspect. Many times our administrator goes. We also ask family to be present. We do not take a new resident unless we can go into their home and make sure that we're able to meet their needs. Awesome. I've heard that from other homes as well, that effort up front is vitally worth it. And I think, you know, different situations warrant different things. You know, not everyone comes from their home into your setting, but anytime you can go to the setting that they're at, or have a video call or a phone call with the person coming to you or their family member or representative to gather information, it is valuable. Any other questions or comments or best practices? Again, it doesn't necessarily have to be on this topic. It could be something else. Okay. Well, it looks like we are at the end of the dialogue here. So I'm going to stay on for a while, but if you don't have any more questions, you are free to log off, and we thank you for coming today.